Welcome everyone. Our presentation is titled The Inside Scoop on Charcoal, done by Rebecca Dawson, Brian McPherson, Marjorie McIntosh, and Igneva Rakshit. The reason why this table clinic topic came to mind was because I had my own experience with charcoal products. On Instagram, I was approached by a charcoal company to promote their product at no cost to me. I already had a large amount of followers and white teeth, which made me an easy target to promote their product. I had just applied to the dental hygiene program and had some second thoughts about the paste. After I posted this picture, I received many messages from different people asking if the product worked, in which I honestly replied I never actually tried it. What shocked me the most was how many people were willing to take advice about an oral health care product from someone who was not a licensed dental professional. Knowing what I know now about charcoal products, I would not have been so eager to jump on that bandwagon. By the end of this presentation, you should be able to understand why the topic is important for oral health professionals, recognize how charcoal products, including dentifrice, mouthwashes, and toothbrushes, can impact the patient's oral cavity and, by extension, their oral health. And lastly, learn how to educate our patients to recognize marketing claims used to persuade consumers.
Product claims. A product information review was done by Brooks and colleagues, which indicated in the charcoal products they looked at that over 50% claim to have therapeutic benefits. 96% of the products claim to have tooth whitening capabilities. 30% claim to strengthen or fortify teeth. 28% of the products reviewed claim to have low abrasivity. 44% claim to have antibacterial or antiseptic agents, as well as 46% claim to detoxify. These consumer appealing terms were seen on 88% of the dentifrices, while only 10% of reviewed products included some form of dental professional endorsement. This could be due to the fact that the ADA and CDA give endorsements based on fluoride content, and the majority of the products in the study did not contain fluoride. While there are many claims being made by companies surrounding the charcoal products, there is only paucity amount of supporting data. The ethics of the approach, scientifically claimed until proven wrong, are questionable at best here.
What is charcoal? Charcoal that is found in most marketed toothpaste we see today is seen in a fine powdered form known as activated charcoal. The charcoal can be made from things such as carbon-rich materials, nutshells, coconut husks, bamboo and peat, and if not made with wood or coal. Why is this important to us as oral health professionals? Charcoal toothpaste and powders are a fashionable oral hygiene product that are a growing trend across the world. As we see many celebrities endorsing natural charcoal toothpaste, we can only expect this trend to increase in popularity. As these products are still in the growing trend, we as oral health professionals are the public's first point of contact when they are searching for information and recommendations. It is critical that as dental hygienists, we are equipped to give our patients the best and most accurate information surrounding the uses, risks, and benefits of these products.
Many of you are probably already aware that large corporations will approach celebrities and social media influencers to help market their products. Your patients maybe are already using celebrity-endorsed dental products too. We can always remind our patients that much of the time, celebrities may have had professional whitening and that their bright smile is not a result of using the product that they endorse. Some useful advice or talking points we can give to our patients who are convinced by celebrity-endorsed dental trends are: advise them to check for independent professional endorsement. This is the best way to find if the products do what they say they do. Another one is to watch the ingredients, and that the amount of fluoride to protect our teeth is up to 1,500 part per million for an adult. Suitability. Check the packaging to make sure it does what they want it to. Another one is not to be seduced by packaging and jargon. Don't be fooled by expensive packaging. And last but not the least, if in doubt, ask the dental team, ask an expert, the dentist, or the hygienist. This is a video of an influencer with a large follower. She is recommending a charcoal product to her followers, and what's interesting to note is that this influencer has no dental training.
I'll just give you the full rundown really quickly. It does work, but what I noticed, you do have to use it for 2 weeks, morning and night, twice a day. So that is the only way that you're really gonna see any difference with this, but it did make a huge difference. But again, I recommend to use it 2 times a day. I love the packaging. If you've noticed me, I'm pretty much always wearing black and white and gray. I love the packaging, I love the colors, I love the style of it. It's very simplistic, it's very modern, and it's very simple, and I really do like it. Another reason why I like this packaging is because it's very soft and kind of velvety.
Brushing with charcoal toothpaste. So in step 1, we can see what the paste looks like when it's initially applied to the teeth. And then in step 2, as the brushing is progressing, the paste turns into a foamy gray lather. And then in step 3 is towards the end of the brushing, when we see some gray appearance still left over the gingival margin and over the surface of the teeth. So it has actually been found that brushing time with charcoal toothpaste may be extended versus using non-charcoal toothpaste, as users are spending more time trying to brush away any residual charcoal that's being left behind and is giving off a gray appearance over their teeth. With the extra time and force that is being spent trying to remove the discoloration, users are potentially at more of a risk for causing abfraction to their teeth due to aggressive brushing.
What are some effects of using charcoal products on the oral cavity? For the tongue, prolonged use of charcoal can cause a blackish gray tongue, which would be a concern during our routine intraoral exam. This may require brushing or scraping of the tongue to be removed. Halitosis. Brushing with charcoal may leave the mouth feeling fresh, but it is short-lived and does not relieve halitosis. There are no therapeutic ingredients contained in these products that will help alleviate halitosis despite the marketing claims. Caries. Be aware, while some charcoal products contain fluoride, not all charcoal products do. In the study we found, only 8% contain fluoride. As clinicians, we need to remind our patients that the majority of these products have limited capacity to both remineralize enamel and prevent caries. Restorations. Charcoal can accumulate and cause staining into surface defects such as restorations and/or tooth anatomy such as deep pits and fissures. This can potentially compromise the aesthetic of tooth color composite restorations and would have to be removed by a dental professional. Periodontal. Charcoal products can become embedded in deep periodontal pockets and gum tissues, causing a discoloration near the gingival margin. This can only be removed by surgical means.
This picture was actually taken by one of our professor's colleagues. This patient had no history of inflammation and, as you can see by the photo, has no biofilm buildup. However, at this appointment, the patient presented with inflammation around the maxillary anteriors. The patient disclosed that they had recently used charcoal toothpaste, and as you can see by the photo, there is actual charcoal particles stuck subgingivally from brushing with this product. Had this patient had deeper pockets, there runs the risk of these particles becoming embedded in periodontal pockets. This is another picture from a different angle. Tooth whitening. Majority of charcoal toothpaste claim to have whitening properties, but studies found insufficient evidence to support these claims made by the toothpaste companies. These studies show only that charcoal toothpaste only removes extrinsic stains and doesn't remove intrinsic stains compared to bleaching products, which creates a lasting and intense impact. The extrinsic stains removed by this toothpaste may reform quickly. For example, a smoker. These toothpaste might only be useful in temporary delaying of tooth staining after a debridement, according to the study. Patients should be educated by the dental professionals about the false claims made by these companies.
Abrasivity of charcoal. The abrasivity of charcoal products may vary depending on the source and how the particles have been prepared. 2 common particles found in charcoal products are hydrated silica and silica. On the Mohs hardness scale, these products are rated between a 5 and a 7. To put this into comparison, the tooth's enamel is rated at only a 5. In order to remove extrinsic stains, these products have to have some level of abrasivity to do so. As a result, this could lead to loss of tooth structure and hypersensitivity. Pertwee and colleagues found that these abrasive materials in charcoal products cause scratches on the enamel surface and a loss of minerals within the enamel. The study then further suggested that a roughened enamel surface can actually promote an increase in biofilm accumulation.
This is a patient who used an over-the-counter charcoal toothpaste. The deleterious effects of abrasive ingredients of charcoal toothpaste is evident in this photo. On the left, we can see the thinning eroded enamel as a result of the abrasive ingredients contained within charcoal toothpaste. As a result, in the after picture, the patient had to resort to expensive dental restorations, where in this case, getting a veneer to repair the eroded enamel. Brushing with charcoal toothpaste can wear away our enamel bit by bit. As the enamel wears and thins away, the underlying structure, the dentine, becomes more visible through the thinning enamel. This in turn will be a bigger concern as this makes our teeth appear yellowish, ruining its original purpose to whiten teeth, as shown in this photo. We can advise our patients that the only proven reliable and safe way for tooth whitening is through an in-office professional tooth whitening.
Charcoal-based mouthwashes. Ingredients and their effect on the oral cavity. A literature review was done by Brooks and colleagues, which found that 14% of charcoal-based mouthwashes contained fluoride. Evidence showed that charcoal may actually reduce the concentration of available fluoride, which then raises questions if charcoal-based mouthwashes that do contain fluoride would even offer any caries protection at all. While these products claim to have anti-halitosis effects, only 8% contained chlorhexidine, which is an agent that is recognized for halitosis management. To date, there are no clinical or laboratory studies published to prove whether these products have cosmetic or therapeutic benefits. Tooth whitening. Most charcoal-based mouthwashes claim to have tooth whitening abilities, which is mostly associated to the abrasivity agents in these products. Only one mouthwash contained hydrogen peroxide as a chemical bleaching agent. However, the typical 30-second rinse time would not be enough to see any actual clinical changes, as 20 to 30 minutes is usually needed to see any results. The inclusion of chlorhexidine in some of these mouthwashes may actually increase surface staining following a prolonged use of the product. Mouth rinses and their periodontal effects. There is no scientific evidence that charcoal-based mouthwashes are effective in the prevention or improvement of gingivitis or periodontal disease. It still remains unclear whether the complete clearance of particles occurs when using these mouthwashes, or if there is long-term residual particles that are being left behind, which can have a negative periodontal impact. Similarly to the charcoal toothpaste, silica particles were found in the mouthwashes, which can have a high abrasivity effect. Many charcoal-based mouthwashes contained acidic ingredients, which can actually lower the pH in the oral cavity. This in turn can lead to tooth erosion.
Charcoal toothbrushes. The pros of using charcoal toothbrushes. Charcoal toothbrush manufacturers have claimed that charcoal toothbrush can reduce bacteria that develops in bristles during the storage. These toothbrushes are made by blending charcoal into nylon bristles, thus reducing bacterial contamination of toothbrushes. 3 studies have shown that charcoal toothbrushes have less bacterial count compared to toothbrushes with non-charcoal bristles. However, out of the 3 studies, only 2 of them showed statistically significant results of charcoal toothbrushes having lesser bacterial count compared to non-charcoal toothbrushes. These studies also happened to calculate their results after testing only for 10 days and 7 days, which can put the efficacy of the study in doubt. According to one more study, charcoal-infused bristles showed less wear and had greater plaque removal success than regular plain nylon bristle toothbrushes under similar conditions and having similar design and dimensions. We are unclear about why charcoal bristles have better plaque removal capacity compared to regular toothbrushes. The cons of using charcoal toothbrush. There has not been many studies done on this topic, and charcoal toothbrushes might retain less bacteria but might cause harm to the oral cavity as the bristles have charcoal in them. Research yet to show any side effects that charcoal-infused bristles might cause to the oral cavity.
Conclusion. Prolonged use of charcoal can negatively impact periodontal health. We also conclude that charcoal has the potential to be abrasive and can have lasting effects on the teeth. And last but not the least, is that there is insufficient evidence supporting whitening claims of charcoal toothpaste.
Takeaways: many claims made by companies surrounding the efficacy of charcoal products, which are not well supported. As dental professionals, we should be knowledgeable about the latest trends so we can provide accurate evidence-based information to patients. Current health trends does not replace good oral hygiene and routine dental visits. Thank you for your time and for listening to us.